Imagine for a moment, your brain is like a complex electrical circuit, a network of neurons firing signals across pathways, enabling you to think, move, feel, and interact with the world around you. Now imagine a surge of electricity disrupting this circuit, causing a momentary malfunction. This is a rudimentary way to understand neurological disorders, a group of conditions that primarily affect the brain and nervous system. And among these disorders, there is one that touches millions of lives, yet remains shrouded in mystery and misunderstanding. Can you guess what it is? In this video, we'll unveil this disorder, demystify its symptoms, explore its causes, and look at the available treatment options. It's time we open up the conversation about epilepsy. Do you know what the fourth most common neurological disease is? It's epilepsy. This condition, characterized by abnormal electrical activity in the brain, affects around 3 million people in the United States alone. Epilepsy doesn't discriminate. It can touch the life of anyone, regardless of age or lifestyle. However, it's more prevalent among children and older adults. Epilepsy manifests itself in the form of seizures, which can range from mild to severe. These seizures are essentially the physical manifestations of the intense electrical activity happening in the brain. Imagine a thunderstorm, but instead of the skies, it's within the complex structure of your brain. Epilepsy is not just a single condition, but a spectrum of disorders with a common characteristic: the tendency to produce seizures. Understanding epilepsy means recognizing its diversity among patients and acknowledging the profound impact it can have on physical, psychological, and social well-being. So how can we recognize this disease? Let's delve into the symptoms. Epilepsy can manifest in different ways, depending on the type of seizure. There are two main categories that seizures fall into: focal seizures and generalized seizures. Focal seizures start in a particular part of the brain. They can be simple, without loss of consciousness, or complex, with loss of consciousness or awareness. During a simple focal seizure, you may experience sudden and unexplained feelings of joy, anger, sadness, or nausea. You might also experience sensory changes like tingling, dizziness, and flashing lights. Complex focal seizures, on the other hand, can cause a loss of consciousness or awareness. This could result in staring into space or not responding normally to your environment, leading to a state of temporary confusion. The second category, generalized seizures, involve all areas of the brain. There are 6 types of generalized seizures, but the most common signs across them include uncontrollable jerking movements of the arms and legs, loss of consciousness, and sometimes loss of bladder or bowel control. Regardless of the type of seizure, there are several symptoms that are common to many people with epilepsy. These can include periods of temporary confusion, a staring spell, uncontrollable jerking movements of the arms and legs, loss of consciousness or awareness, and psychological symptoms such as fear, anxiety, and déjà vu. It's also important to note that symptoms can vary from person to person, and not everyone will experience all of these signs. However, understanding these symptoms can be key to recognizing and managing epilepsy effectively. Now that we know the symptoms, what causes this neurological disease? The causes of epilepsy can vary, and in about half of cases, there's no apparent cause. This statement, while true, doesn't quite capture the complexity of the situation. So let's delve a little deeper, shall we? Starting with genetic abnormalities, it's crucial to understand that epilepsy isn't necessarily inherited. However, certain types of epilepsy are linked to specific genetic variations. Think of it like a puzzle piece that doesn't quite fit, causing the picture to be incomplete. This genetic misfit can sometimes lead to abnormal electrical brain activity, which in turn triggers seizures. Next, we have brain infections. These could be anything from meningitis to encephalitis or even a brain abscess. These infections can cause inflammation and damage to brain tissues, creating conditions ripe for seizures. Then, we come to prenatal injuries. This refers to any damage or disruption that occurs while a baby is still in the womb. It could be due to an infection, maternal drug use, or even lack of nutrition. These factors can impact the development of the baby's brain, potentially paving the way for epilepsy. And finally, developmental disorders like autism and neurofibromatosis can also play a role in epilepsy. These conditions often involve brain abnormalities, which can increase the likelihood of seizures. However, as we mentioned at the start, in about half of the cases, the cause remains an enigma. The brain, as you can see, is a complex organ, and the causes of epilepsy are just as intricate and varied. Knowing the causes is important, but how do we confirm an epilepsy diagnosis? That's a question we'll delve into in the next segment, so do stay tuned. Diagnosis of epilepsy involves a series of tests. This journey to identify the condition is a meticulous one, employing various methods to ensure accuracy. It's much like piecing together a puzzle, each test providing another piece that brings us closer to understanding the whole picture. A common starting point is the neurological examination. This is where doctors assess behavior, motor abilities, mental function, and other areas to determine the impact on the nervous system. It's like a general health checkup, but with a focus on the brain and nerves. Next, we delve into the realm of blood tests. These can help identify potential causes of seizures that aren't immediately visible, such as genetic abnormalities, infections, or chemical imbalances. Think of it as a detective looking for clues in a complex case. Then we come to the EEG or electroencephalogram, a test that records the brain's electrical activity. Imagine it as a seismograph, but instead of tracking earthquakes, it's tracing the electrical waves in your brain. Anomalies in these patterns can signify epilepsy. Equally important are CT scans and brain imaging. These offer a more detailed look at the brain structure, helping identify areas that might be causing seizures. Picture it as taking an in-depth tour of a complex building, looking for any signs of disruption. Lastly, neuropsychological tests come into play. These evaluate memory, speech, and other cognitive functions, shedding light on how seizures might be affecting these areas. It's akin to a stress test for your cognitive abilities. Throughout this process, keeping a detailed seizure journal can be incredibly valuable. It's like a personal diary, documenting each seizure's occurrence, duration, and accompanying symptoms, becoming an essential tool in the diagnostic process. So we've pieced together the puzzle, and the picture is clear. Once diagnosed, what are the treatment options available? Well, let's journey on and explore that in the next segment. Treating epilepsy involves a combination of medications, surgery, and brain stimulation. Let's delve into these a bit more. Firstly, medications. There's a vast array of anti-epileptic drugs available, each with unique benefits and side effects. It's not a one-size-fits-all situation. The choice of medication is tailored to the individual's needs, considering factors such as the type of seizures, age, overall health, and the potential for interactions with other medications. Next, we have surgery. This is usually considered when medications aren't effective, or when seizures are localized to a specific area of the brain that can be safely removed. It's important to note that surgery is not a guaranteed cure, but it can significantly reduce the frequency and severity of seizures in many individuals. Lastly, there's brain stimulation. This involves sending electrical impulses to the brain to help control seizures. One example is vagus nerve stimulation, where a device is implanted under the skin to send pulses to a large nerve in the neck. Another is responsive neurostimulation, where a device within the skull monitors brain activity and delivers an electrical stimulation when a seizure is detected. And let's not forget the role of ongoing research. It's through dedicated scientific inquiry that we continue to improve our understanding of epilepsy and develop better treatment options. This includes exploring the genetic underpinnings of the condition, investigating new medications and surgical techniques, and refining brain stimulation methods. Epilepsy might be common, but with the right understanding and treatment, it can be managed. So, we've delved into the world of epilepsy, a common yet often misunderstood neurological disease. Epilepsy, affecting around 3 million people in the US alone, is characterized by abnormal electrical brain activity, leading to seizures. It can occur in anyone, but children and older adults are more susceptible. We've learned that the symptoms of epilepsy can vary depending on the type of seizure. Common signs include temporary confusion, staring spells, uncontrollable jerking, and even loss of consciousness. Fear, anxiety, and déjà vu are also often experienced. The causes of epilepsy can range from genetic abnormalities and brain infections to prenatal injuries and developmental disorders. However, in about half of the cases, there is no apparent cause. The diagnosis process may involve neurological exams, blood tests, electroencephalogram, kinetic scans, brain imaging, and neuropsychological tests. Treatment options include medications, surgery, and brain stimulation. Keeping a detailed seizure journal can be an essential part of managing treatment. With knowledge and understanding, we can better support those living with epilepsy and contribute to ongoing efforts to improve treatment and care.